and Dr. Tamalian talking about in a two-time recurrent disc herniation, what's the role for another recurrent decompression versus fusing? So thanks, Russ.
Great. Thanks, Sig. And obviously, I don't think we're going to come up with any answers, but I think, unfairly, I got the right choice here. So MIS decompression is certainly, I think, the optimal choice. And why is that? So let's keep the problem in mind, right? I mean, this is the case that we discussed, I think it was on Friday night, around a patient with a third-time recurrence. The issue in these patients is generally a neurological problem, radiculopathy-related symptoms. And I think we all talk about two approaches, the revision decompression discectomy versus the revision decompression plus fusion. But let's not forget that there are potentially other options. Rick Sasso talked about this, so I added it to my slide. Anterior discectomy with total disc replacement certainly could be an option, not one that I've done, but I think that there are multiple ways to treat this patient. Importantly, we don't practice in a vacuum. So I'm not suggesting here that you should never do a fusion for a recurrent herniation. So when should you think about fusion? If there's obvious instability, if there's very little to no facet remaining, or if you think you need to restore disc height in order to get an adequate neurological decompression. But these are very specific things in specific cases, and what we're talking about is what's the optimal treatment. And when we think about the definition of optimal, it's really what's best, most favorable, and most desirable. And I think if any of us in this room had a third-time, fourth-time recurrent disc herniation, and there was an option to have a decompression or discectomy done, then that is what I would imagine the majority of us would choose. I know certainly I would. So what we really have to figure out is what's the most desirable treatment for herniated disc or stenosis. Would anybody in this room say that that is fusion? I would say the most desirable treatment is a non-fusion surgery, and so we should always be thinking about that as the optimal treatment. Now, this, Kate just showed some great literature on the sort of chances of recurrent disc herniation, but the treatment of recurrent disc herniation, the literature is not so helpful. I mean, this is a systematic review that essentially says there's probably little to no difference, but studies are limited. This was an original case report from Rick Geyer around, the idea of doing perhaps total disc replacement in these patients, and there's been a systematic review done on this more recently that shows favorable outcomes, but the literature really is not helpful in saying when you should do what, so you have to use common sense. If you put this into AI, the optimal treatment for a third herniation of the same disc is a revision discectomy. So I think if we think about what is, the majority of the literature say, it says, think about a decompression. So I really think about this as, what are my personal goals in treating any patients? You want to get symptom relief, you want to get improved functional outcomes, you want to do a procedure that is of low morbidity, and you want to think about cost effectiveness. So what is revision discectomy? What's the literature out there in terms of symptom relief? It's good. It's effective in alleviating radiculopathy, pain, and neurologic deficit. What about functional outcome? Also good. Revision discectomy shows significant improvement in functional scores, shorter recovery times compared to fusion. What about morbidity of procedure? In general, revision discectomy is associated with minimal blood loss. Now, certainly, I think MIS TLIF, which I'm sure Lou will talk about, is a very good operation, but let's think about optimal, not about specific scenarios. And when we think about cost effectiveness, in general, revision discectomy is a less expensive operation than spinal fusion surgery. So, I had to think about why would somebody this smart try to tell us that fusion is the right option? Didn't make sense to me. I mean, Lou's incredibly accomplished. You could see, surgical internship in the Navy Medical Center, diving officer. He's now at Barrow, which I believe a lot of people consider the HSS of neurosurgery, and he's a professor of neurosurgery. So certainly well accomplished. I did happen to look up some reviews on Lou, and these were interesting. This patient said he was so excited that Lou recommended a 4-level disc arthroplasty for thoracic spinal cord compression. I thought that was a little unusual. Also found this other one where this patient didn't like him as much. He said he just kept talking to him about the whole time about how some guy Uribe would do it, and he was nervous that he might get yelled at. So you have to take this all with a grain of salt. And then I said, is he innovative or is he conflicted? This was an article about a new device that Lou is developing around spinal fusion surgery. And it was interesting when I really honed in, he's offering spinal fusion surgery to relieve pain from bulging discs. So that was certainly a little concerning. And then I finally looked up disclosure information, and Lou's disclosures are, I mean, I certainly aspire to be like Lou. I don't think some of these companies are even in spine surgery anymore. And we all have disclosures. I mean, I've got mine. So, you know, look, I mean, it's all appropriate. But I would say, you know, at the end of the day, my take-home message would be the optimal treatment for symptoms that are coming from nerve compression should be decompression. You should consider fusion, but it should be in certain circumstances, not the go-to. And if you're considering fusion, maybe think about emotion-preserving surgery. Thanks so much.